Hi, I'm Dr. Stephen Fenton. I'm a cardiologist. I'm a general cardiologist, but increasingly over the last 20 years or so, what's called a preventative cardiologist. In the 38 odd years that I've been in cardiology, there have been some absolutely amazing advances in various fields, and this includes things like imaging, where we look at the heart with ultrasound or CT X-ray or magnetic resonance imaging. We've had fantastic developments in therapeutics with drugs and procedures such as bypass surgery, and fantastic advances in valvular heart disease. Despite all of these amazing advances, heart disease remains the leading killer. It accounts for about 30% of mortality in Australia, around over 40% in Europe, and around the same in the United States. Heart attacks are very frequent and occur in Australia about every 8 minutes, and of these, 1 in 3 at the moment is fatal, which means there'll be a fatality every 26 minutes. Now, the sad part about what we have available today is if you get to a hospital, you've got about a 90% chance of surviving a heart attack, but half of folks, about 50%, don't make it to hospital. This means that it is vital for us to be right on our game in terms of preventive cardiology. And this is my interest, and this is why I have been involved in the development of Heart Initiative, which is a heart program, a heart wellness program, which is at its center a motto of prevention by early detection. The disease which kills people from heart attacks is actually atherosclerosis, and the Heart Initiative's very strong on the concept of using the detection and quantification of atherosclerosis as the way for helping to prevent heart attacks by its early identification. And it is now increasingly widely recognized around the world is to determine who should have plaque testing or atherosclerosis testing, and the best test to do this is called a CT coronary calcium score. Now, a CT coronary calcium score is a very simple X-ray test, which is very much like a mammogram of the heart. It involves a patient going to an X-ray service, taking a breath hold and having a quick picture. And it is quick, about 5 or 10 minutes, it is painless, it involves no dye and no injections, and it is minimal radiation. So the real message that the Heart Initiative wants to get out is that CT coronary calcium scoring is the best test to determine an individual's risk for the potential to have a potentially fatal heart attack.